Hi guys! Today I wanted to talk about immune-mediated hemolytic anemia, which is a blood disorder where the immune system attacks the red blood cells. This is a disease that we see in both cats and dogs, but it is more common in dogs. Most of the time we have no idea what causes this, and that's what's so frustrating about it. About 85% of cases have no underlying cause. So just like a person that gets Crohn's disease or a person that gets rheumatoid arthritis, a lot of autoimmune disorders happen for no identifiable reason, or at least a reason that we can't pick up. In about 10 to 15% of cases, we do see that certain medications, so antibiotics such as amoxicillin or Clavamox, sulfa antibiotics or cephalosporin antibiotics can cause this. Vaccines have been reported to cause this as well, and usually we're looking for vaccines that have been given in the month leading up to the diagnosis. We can also see cancers that can do this, and infections, so like tick-borne diseases in particular. So those would be the big things. Most patients that present to me tend to have signs associated with anemia, so low red blood cell percentage. And in some cases that can present as weakness or collapse, just lethargy, so just being very tired. Sometimes with having a low red blood cell percentage, we can see symptoms of gastrointestinal signs, so vomiting, diarrhea, that sort of thing. We also can see evidence of red blood cell destruction actually in the urine or stool. And so what happens is when red blood cells are broken down in too high a number, the body has to get rid of these byproducts. And often what we'll see is a really bright orange or dark orange urine, or even stool that is orange in color. And so those are often the signs that tip an owner off to say that there's something not quite right. This list is not exhaustive, so in some cases we have patients that have symptoms that are very mild or present in full shock, and so it can really run the gamut of what we see. But in all of these cases, what we'll find is an anemia. We often will see signs of jaundice, basically yellowing of the skin or eyes because of the red blood cell breakdown. And then any sort of clinical signs that come from that. So it really can vary patient to patient. What we're looking for to make the diagnosis is not only an anemia, but we also want to find evidence that the immune system is the cause of this anemia. And we want to see an anemia that is hemolytic in nature, meaning that the red blood cells are actively being broken apart in the body. The signs that we can see to indicate that the immune system is responsible for this are either going to be changes in the red blood cell appearance. So basically when the immune system starts to destroy the red blood cells, they'll take a bite of the outer membrane of the red blood cell and leave the same volume on the inside. And so this change in shape is called spherocytosis. So basically the red blood cell, instead of being nice and concave in the middle, will actually take the shape of a sphere. We can also see that the red blood cells are being clumped together. So when the immune system starts to attack the red blood cells, antibodies will actually draw a bunch of red blood cells together, holds them together, and so that's called autoagglutination. The other things that we can look for, because sometimes we don't find all of those signs in the blood work, but another thing that we can look for is a positive Coombs test, which basically means that there are antibodies that are identified on the surface of a red blood cell, which is not something that would happen normally. Your body should never attack its own cells, otherwise we wouldn't be here. Sometimes we just have to have a suspicion that that's what's going on, especially if we have an anemia and there's no other cause, and the anemia has alongside it the jaundice, and we have a patient that's showing symptoms of the anemia that's come on very quickly. when I have a patient that presents with this disorder, not only do I want to try to identify that this is the disease that's going on, but I also want to look for potential causes. So again, I mentioned earlier certain medications, vaccines, cancers, infectious diseases like tick-borne diseases. So I want to look for all of those things. And ideally, if we could do a full diagnostic workup, I'd not only be looking for evidence that the red blood cells are being broken down by the immune system, but also to do x-rays of the chest or ultrasound of the belly to look for evidence of cancer. I want to grab some extra blood samples so we can submit and look for infectious disease test. I want to get a urine sample to look and see if there's a urinary tract infection. So all of those things can be really important if we want to identify what may have triggered this. If you remember in the beginning, I said that about 85% of patients don't have an underlying cause. And so if finances are a concern, in some cases I won't do those tests, but there's always a chance that we could miss something. And there's always a chance that if we're missing something, we may not get the response that we want to see to treatment. And so it can be really important to look for some of these things if we have the ability to do so. And again, pet insurance is really important. So that way, again, we don't have to cut corners if we can avoid it. The treatment for this disorder, so once we've identified that the red blood cells are being destroyed by the immune system, once we've identified that there's no cause of this disorder that we can identify, then the treatment is immune suppression. So we have to get the body to stop attacking itself, and the only way of doing that is with medications that suppress the immune system. Steroids are going to be the main treatment. That's the gold standard treatment for these sorts of disorders. And it's a really high dose of steroids because we need to get the body to forget to attack itself. Alongside steroids like prednisone, or in the hospital injectable different steroids like dexamethasone or dexamethasone SP, we also want to sometimes reach for other medications to interrupt this immune response, because if we just use steroids alone, in a lot of cases we're having to stick with really high doses a lot longer than we may do if we can add something else in to help out. So there's medications that help suppress the immune system, such as cyclosporin or azathioprine or mycophenolate. All of those medications are things that we'll reach for, and it really kind of depends on the size of the pet, if there's any cost concerns. And there's other medications out there too, but those are probably the main ones that we reach for. The other things that we'll put these patients on are going to be things that help with any of the other clinical signs that they're presenting with. So again, I mentioned with the anemia, if it's really profound, giving blood transfusions to help boost the red blood cells to keep them stable while we're waiting for our medications to work is really important. I always tell people blood transfusions are not fixing the disorder. They're just keeping the patient stable long enough for our medications to work, because our medications aren't going to work instantaneously. They're usually going to take somewhere in the ballpark of 3 to 5 days, sometimes even more than that. So it depends patient to patient. And so a blood transfusion or multiple blood transfusions are often needed to keep these patients stable during that process. Those are kind of the main treatments that we're looking for. Is we need to suppress the immune system, we need to treat any other symptoms that are going on, and then we need to keep the patient stable during this process. My criteria for sending these patients home is for them to have a stable anemia for at least 24 hours. I'm not expecting that they're going to be free of disease at that point in time. I just want them stable enough so that they can go home and my owners don't have to worry that they're going to crash. Typically, if you look in the literature, it can be anywhere from 50% survival. I tend to think that we probably have higher than that, so maybe in the 70% ballpark, but there are some patients that aren't going to survive to go home, and unfortunately that's something that we do make people aware of, but until you give them that 3 to 5 days to see what they can do, you just don't know which patient's going to make it and which is not. The more sick they come in, the more worried we are and the more guarded the prognosis is. The more jaundiced they are, the more guarded the prognosis is. And if they have a lot of blood work changes as far as their other organs like kidney values and those sorts of things, then I start to worry that they may not make it to the end of hospitalization. Patients with immune-mediated hemolytic anemia are also highly at risk for forming clots. And that's thought to be because this immune system response that's so abnormal is so inflammatory. The body thinks that it's under attack by a foreign entity. And then we also have all these red blood cells that are sticking together. And so these patients tend to be at high risk of forming clots. So another medication that we have them on often is blood thinner medication to try to keep them from forming blood clots. The risk of blood clots actually follows them until they're off of steroids completely. And so it's not a quick thing. Once these patients leave the hospital, the ordeal is not over. Those are typically the patients that we expect are going to go into remission, but it's not always the case. There's probably maybe 30% of patients that will not respond or not go into remission. And then there's about 30% of patients that they will go into remission, but as we taper their medications, the disease comes back. And that means they need to stay on treatment indefinitely. I'd mentioned before that the treatment for this disorder is immune suppression. And so what we want to try to do is keep them on the immune suppressant. So steroids and whatever other medications we have them on to suppress the immune system, plus the blood thinners. We want to have them on those therapies until their anemia completely resolves. Normally that's going to happen within the first couple of weeks, but there are some patients, if the site of red blood cell attack is happening in their bone marrow, it may actually take them longer to respond. Once we get them into remission, then we start to painfully slowly cut back their immune suppression one at a time while we watch their red blood cell count closely. And so that means making a small decrease in their medication and then rechecking their red blood cell percentage to make sure that they don't come out of remission. And so that whole process of slowly tapering them and watching their counts closely can be, a 3 to 6 month process. Again, sometimes it's longer than that. And again, if they come out of remission while they're on treatment, we usually will keep them on the dose of medication that work to keep their immune system under control. Most patients, if they can go into remission and be in remission, continue to stay in remission as we taper their medications, often those pets can go on and live normal lives. I tend to recommend that these patients avoid anything that may stimulate their immune system, and so that actually can include vaccines, that can include certain antibiotics, so I try to be really careful. If we know one of these things caused the disorder, then just avoiding that can be all we need to do to keep them healthy. But in some cases, if we don't know, I tend to recommend to clients that we just play it safe for the rest of their lives. Obviously, for every pet, there's going to be certain risk factors for them. And so if avoiding vaccines is not something that we can do, so like hunting dogs or dogs that are involved in show, if they're going to be around infectious diseases, and those might be patients that we do need to give them vaccines. We just have to watch very, very closely. And so again, there's not a one-size-fits-all strategy. It really depends on the conversation with the client and, again, the risk factors for that pet. Again, if we have a pet that comes out of remission during our tapering of the medications, then we keep them on those drugs indefinitely. And again, that's going to have some risk factors that come along with it. And so we have to monitor those patients closely. If we have a patient that unfortunately doesn't respond to treatment, then often those are patients that we're looking for euthanasia, and unfortunately that is something that we sometimes see. But again, I do think this is a disease that is in many cases treatable, manageable. but it's very, very expensive to get them stable enough to go home, and then it's very expensive to monitor them after that. So again, I think pet insurance is very important for these guys and for any pet, honestly. Well, thank you guys for joining me again. If you have any questions, let me know. Please subscribe, please follow me, tell your friends, and if there's any content that you want to see, let me know as well. All right, have a good day. Bye.